Hi, Dr. Doug Graham here. Today is October 20th, 2014. Today is my first day off since the 10th of August when I went to the Woodstock Fruit Festival on the 11th. Traveled on the 11th and continued to the Presenting Excellence in Woodstock Fruit Festival. The day the Woodstock Fruit Festival ended, I traveled out here to Sedro-Woolley, Washington, where I've been working 100 hours per week, every week at private events ever since. It's been an incredible time, 70 days of continuous giving. I love doing that, teaching and sharing with people. It's been a treat, but it's been really busy. I know that my voice needs to be heard, and both for me to feel better about just saying what seems important to me, but also for anybody who's interested, for supporters and naysayers alike. I really want all sides to be heard, so I'm glad to finally now have the time to be able to sit in front of a camera and share with you my views on the proceedings of the past few months. When I take people through an experience such as fasting, I know that there's going to be trials. Pretty much everyone goes through challenges as they fast, and I often talk about fasting being the great equalizer. It brings everybody to that point where they wonder if they can go on and if they should go on. And of course, my role as a facilitator is simply to make sure that people don't get into situations that are so dangerous that if they need help, they can't get that help. So I watch people go through a fast. I watched Leah go through her fast. It was a really hard thing to watch. I talked with her every day in private conversations, asking her if she wished to continue, giving her a clue as to what to expect and how the fast would likely progress, what the challenges would be in coming out of a fast after having her particular health situation that had been going on for more than a year. And I knew that this was going to be a tough experience, and that Leah was a very tough young lady. She's got triathlete experience behind her. She's got a lot of life experience behind her. And she expressed to me each day a willingness to go one more day. It's always her decision how long did she wish to fast. When she got to the point where she said, I don't wish to fast anymore, I said, okay, this is the day. We'll break the fast immediately, the same day. And that decision was made, and that's the decision we followed. You know, I felt for Leah, and I still feel for Leah. In fact, I feel for every person who I interact with in my life, and certainly every patient, every client, every customer that I've ever had, that I feel for them. I know they're going through a lot of trial. It's difficult to make changes. It's difficult to struggle or to feel as if you're struggling. And I do all I can to ease that for people and make it as bearable as possible to go through what each of us has to go through to get to the other side, to get to that higher level of health that we know comes with taking great care of ourselves. So there was never a time where I felt callous or uncaring. I mean, it's something that touches me deeply. As Leah knows and everybody else knows, I told hundreds of case history stories about people who have been under my care in the past, and I remember each and every one of them very well and use their names, and it's a very emotional experience for me to watch people go through health recreation. As we tell everybody, it's a lot easier to stay healthy than it is to get healthy, but the return on investment, the effort is always worthwhile. We call it productive pain because you do come out the other side in a far better place than the place that you left behind. And I know that's, as Leah has made clear, that she's still following 80-10-10, that she's feeling much better, that many of her health problems have been left in the past, left in Costa Rica, and she's not suffering with those challenges anymore, and I'm glad for that. hygienic practitioners, and especially those hygienic practitioners that offer supervision in fasting, do run a tremendous risk from many different angles. Shelton was jailed many times for supposedly practicing medicine without a license, although every time that came to nothing. And I know that fasting is rarely, if ever, the first thing that people think about. Normally, when I see people who are talking to me about fasting, they're talking to me because they've tried what they call everything else first, often 20 and 30 different types of possible solutions or remedies or options before they consider fasting as a possible option. It's very often the last ditch option. I know in my own practice that I've taken many people who wanted to fast but were told by other fasting practitioners that fasting wasn't going to be an option simply because the risks were great. It's not that I like to take risks, and certainly not with any other people, but my heart goes out to them. I really feel for them. I know what I went through when I fasted, and I know the benefits that I gained from my fast. I mean, I fasted a 30-day fast. It wasn't effortless by any means. There were times where it was exceptionally challenging. Recovery was a drawn-out process for me as well. But when I look at the results that come from fasting, the results are so profound, the health benefits so significant. The people who have been through fast and come out the other side with regained health and regained mental clarity, abilities that they never had before, that they come back thriving where they were failing to thrive in so many different areas, that to me it's so touching and so moving that I still offer fast. I know that people come to fast specifically because it's an option that other people aren't offering. And I know that even among fasters, there are different kinds of supervision. There's supervision where people come to fast and they're just left alone for weeks at a time. And there's fasting supervision where people are medically supervised with blood work and lab work and lots of medical attention on a near daily basis. What I offer is very middle of the road to that. I'm offering daily supervision, but in a non-invasive fashion. We're not doing blood work unless it's called for, although the laboratory is only 9 kilometers away. We can do lab work if it's needed. And I do have several doctors with whom I stay in touch, a medical doctor and a dentist with whom I stay in touch while I'm supervising my fasts. But we make it as non-invasive as possible, and we make that option clear before anyone registers to fast with me, that that's what we'll do, and there are other options available. People love me because I offer a non-medical supervised fast, but they also love to hate me because I offer a non-medical supervised fast. And I know I can't please everyone, nor do I try. I want to offer what I do. I want to do a great job doing what I do. I do the very best I can. And if people want to have a medically supervised fast, they can go to the places that offer such a fast. If they want to have a place to fast but be left alone, we recommend that there are 3 or 4 different places I know of where they can go and fast and pretty much be left alone through the duration of their fast. All of those options exist. I offer supervised fasting in the method that I do it because it makes such a profound difference to the individuals who do fast. The word doctor, when traced to its roots, technically means teacher, and typically, if we go back far enough, we see that doctors functioned as teachers, telling people what to do, how to take care of themselves, rather than giving them prescriptions or performing surgery or using drugs. Doctor is still known as teacher in many different avenues today. I am technically a doctor because I've been through the medical and chiropractic training that enabled me to earn a degree as a doctor of chiropractic medicine. When I was a student, I was a student. When I graduated from school, I became a doctor. My name changed. I'm no longer Mr. Graham. I am Dr. Graham, and that's the appropriate title to use. I'm not in private practice anymore, and I don't carry a license anywhere to be in private practice, but my name will remain doctor for as long as I live. I don't pretend to be a medical doctor. In fact, I don't wish to be a medical doctor or mistaken for one, but I am a doctor of chiropractic medicine. I'm also a doctor of hygienic medicine, but using the name and the title doctor is simply appropriate for who I am at this time. I'm truly deeply saddened by the events that have resulted after this year's Woodstock Fruit Festival. I feel the loss of that family very deeply. I've given my heart and soul to the Woodstock experience from its first inception through the first year and every year thereafter. I volunteer a tremendous amount of my time into helping the Woodstock event be as good as it can be every year. And when I'm at Woodstock, I always give my all. This year at Woodstock, I taught 34 classes per week, and each of the 2 weeks. And I'm happy to do that. I'm thrilled to interact with people. I take it as a personal mission to meet everyone at Woodstock, and although I don't always succeed, my goal is to touch base with all the people I've known from the past and to meet as many new people as humanly possible, everyone if I possibly can. I feel a great loss in my ability to interact with those people and to support those people in future. I feel saddened. I feel sorry for the people who will not get to spend their time with me, having their questions answered, having photos taken, or just interacting in any way that people seem to love to do. And I know I'm going to miss having the opportunities to be with my family at Woodstock. This year has been a really tumultuous one for me. My website was hacked and completely destroyed. We had to build it anew from the ground up. I've released several new books and have several more coming before a full year has evolved. And with the events at Woodstock also, and the emergence of so many new fruit festivals that are based on the teachings of 80-10-10, a lot has changed for me this year. Fortunately, I'm still going to be offering my private events as I have in all the years gone by. We'll be offering Costa Rica events. We'll be offering our extended program at Sedro-Woolley, Washington. We're offering 8 weeks worth of programs next year. This to me is really fantastic. I'm focusing in on the creation of new books and new materials, including a new website forum, as well as an 80-10-10 family program that we want to make available to as many people who wish to be supported in their efforts to succeed at 80-10-10. I think that the year holds tremendous promise, and I look forward to actually expanding our program in Sedro-Woolley even further as the demand for new events and new programs there has really mushroomed. So for me, for the upcoming year, I'm going to focus on my own books and then help to create the new programs that we've just gotten rolling, the extra support programs for people who are looking to gain that support in their 80-10-10 lifestyle. As you all know, it's always been my personal and professional policy not to talk about people and really not even spend much time talking about things, But for my focus, I feel my most worthy efforts are in ideas. I don't hold grudges, but my memory is good. Obviously, if I bury the hatchet, which I'm always willing to do, it doesn't mean I forget that a hatchet was buried. But I don't hold grudges. Reconciliation from my part is always possible. I think that some rash decisions were made, and I feel badly that they were made, but this is often the case when people don't have enough information. For me, I would love to be back at the Woodstock Fruit Festival. I think it would just be the greatest thing to be participating with the people, to be involved in the classes and the different educational settings that really are my forte. And I hope that that can happen someday in the future.